Let's get right into our gastrointestinal system masterclass explainer. Welcome back, future nurses. It's your coach at NCLEX-bay. Today, we're tackling the GI system, so let's make these concepts stick. Section 1, the GI Masterclass on vomiting risks. Let's jump right in. So when a kiddo vomits, your nursing brain needs to immediately jump to the highest priority risks. The boards aren't just going to ask you what vomiting is. They want to know what you're most afraid of happening next as a direct complication. We've got 3 massive dangers here. Dehydration is obviously a huge concern, especially in small children, along with the rapid loss of overall fluid volume and those critical electrolytes. But look really closely at that third point, the development of metabolic alkalosis. That right there is absolute NCLEX gold. Severe, prolonged vomiting causes the child to lose massive amounts of gastric acid straight from their stomach. Losing that acid tips their body's pH straight into an alkaline state. If you see a pediatric patient with severe vomiting, you need to immediately think metabolic alkalosis.
Okay, picture this. What if a child suddenly vomits while you're in the room? This is a critical, literally life-saving moment. Number 1, you absolutely must maintain a patent airway. But how do you do that practically in a split second? You immediately position the child on their side. Do not wait, do not run out to grab an emesis basin first. Turn them on their side right away. This simple positioning lets gravity naturally clear the airway and prevents the pooling and inhalation of that emesis. You're stopping aspiration pneumonia before it can even start. And of course, always keep your suction equipment ready and on standby at the bedside.
Moving on to Section 2, Key NCLEX Signs. Get ready for some crucial pattern recognition.
Take a look at the anatomy of Hirschsprung's disease here. Focus right on the lower portion, the rectum. Do you see how narrow it is? That's the aganglionic portion. What that means is there are absolutely no ganglia nerve cells present there to stimulate normal peristalsis. Because nothing can actively move through that tight, paralyzed section, everything backs up above it. And that causes the massive, distended sigmoid colon you're seeing right above the stricture. Because the stool is forcibly squeezed past that incredibly tight, narrow segment, it completely changes the shape of what comes out. And that brings us to the ultimate comparison for your exam. Here's the absolute crucial point. If a question describes projectile vomiting, and we mean forceful vomiting that usually happens right after a feeding, you must immediately think pyloric stenosis. The pyloric canal is just so enlarged, tight, and narrow that the stomach forcefully ejects its contents just to relieve the pressure. Conversely, if a question describes ribbon-like, foul-smelling stools, you are definitely looking at Hirschsprung's disease. The stool is being squeezed through that narrow aganglionic section we just talked about, honestly just like toothpaste being forced out of a tube. Projectile means pyloric. Ribbon-like means Hirschsprung's. Lock that contrast into your memory right now. Now let's see if you're ready for the exam. I have 5 challenge questions for you. I will read the question and the options. Then I'll give you exactly 5 seconds to think before I reveal the correct answer and the rationale. Let's go.
Question 1. What is a major metabolic complication associated with severe vomiting in a child? Option 1, metabolic acidosis. Option 2, metabolic alkalosis. Option 3, hyperkalemia. Option 4, hypernatremia.
The correct answer is 2, metabolic alkalosis. Vomiting causes a significant loss of gastric acid, fluid, and electrolytes, directly leading to a state of metabolic alkalosis.
Question 2. A child suddenly vomits. What is the priority nursing intervention to prevent aspiration? Option 1, administer antiemetics. Option 2, assess for dehydration. Option 3, position the child on the side. Option 4, provide oral rehydration.
The correct answer is 3. Position the child on the side. Positioning the vomiting child on their side allows gravity to clear the airway and immediately prevents the pooling and inhalation of emesis.
Question 3. A nurse is assessing an infant with suspected hypertrophic pyloric stenosis. Which findings should the nurse expect? Option 1, ribbon-like stools. Option 2, bile-stained vomitus. Option 3, projectile vomitus. Option 4, diarrhea.
The correct answer is 3, projectile vomiting. The hypertrophy and narrowing of the pyloric canal cause extreme pressure, resulting in forceful projectile vomiting, usually shortly after a feeding. Question 4. An infant has a suspected diagnosis of Hirschsprung's disease. Which sign most likely led the mother to seek health care? Option 1, diarrhea. Option 2, projectile vomiting. Option 3, regurgitation of feedings.
Option 4, foul-smelling ribbon-like stools.
The correct answer is 4. Foul-smelling, ribbon-like stools. The lack of ganglion cells in the rectum causes chronic constipation, and stool that is squeezed past this narrow segment appears thin and ribbon-like.
Question 5. What characteristic of the vomitus is expected in a child with hypertrophic pyloric stenosis? Option 1. Current jelly-like. Option 2. Contains bile. Option 3. Does not usually contain bile. Option 4. Fecal emesis.
The correct answer is 3. Does not usually contain bile, because the stricture in pyloric stenosis occurs before the duodenum, where bile actually enters the GI tract. The forceful emesis contains gastric contents like milk or formula, but absolutely no bile. How many did you get? If you got 5 out of 5, you're a GI master. Don't forget to save this explainer for your final review and follow NCLEX-bay for more. You've got this.